I'm talking today with Associate Professor Mark Stoove, who is head of the HIV and Justice Health Research Program here at the Burnet Institute in Melbourne. Thanks for your time, Mark.
No problem. Thanks for asking me.
No worries. You've just co-authored a perspective for our 19th of October issue on prison needle and syringe programs.
That's correct.
Tell us a bit about why Australia seems to like needle and syringe programs, but not in the prisons.
Right. Look, it's not something that Australia alone struggles with. There are many countries around the world, dozens of countries that support community needle and syringe programs, but don't have those programs in prisons.
Right.
In fact, only 8 countries around the world currently maintain prison needle and syringe programs. But look, I think it largely comes down to a philosophical and somewhat conceptual notion of having a program that is implicitly about preventing, disease,
Yep.
but is also implicitly about an illegal behaviour.
Right.
Now, while disease prevention, regardless of the illicit behaviour, is something that is seen as reasonably acceptable and sensible in the community, it is a conceptual jump to then take that from the community and actually place it within an environment that is a legal environment. It is part of a justice system.
Yeah.
So, while we can go on about the evidence that supports prison needle and syringe program, the concept of introducing something into a justice system and into a justice related site,
Yeah.
that implicitly includes support for an illegal behaviour within that justice site. I think people have, a conceptual problem with that. It is also political. It's a
Yeah.
political barrier. I have spoken with politicians about this issue, and look, privately, many, see the logic of a prison needle and syringe program. It's another thing taking it to the public and feeling like you can sell that
Yeah.
to the public. There ain't any political wins in in supporting a prison needle and syringe program. My argument to them is that having drugs in prison is not their political failure. It's not Victoria's political failure. It's not New South Wales, ACT. It's not Spain's political failure.
Mm-hmm.
There is not a prison system in the world that has managed to keep drugs out of it.
Yeah.
So it is not, the fact that drugs are in prison is not a systems failure that belongs to you. It's a global failure of our inability to approach the issues around illicit drugs.
Yeah.
In a health framework, in a sensible, logical framework. It is a product of the criminalisation of drug use, the routine incarceration of people with dependent drug use histories.
Yeah.
For offences that relate to their current drug use.
Yeah.
So you're basically locking people up with an addiction, a physical and psychological addiction in an environment where, drugs are available, and you've created a commodity.
Yeah.
Within that environment. So you can argue this from a number of perspectives. I think you can certainly argue it from a human rights perspective.
Right.
And there are a number of covenants and other documents around the world that talk about this notion of a healthy prison concept. And that really involves that people who are incarcerated have the right to certain services, particularly those related to health services, that they would otherwise have available to them in the community.
Yeah.
Just by putting someone in prison doesn't allow a system to deny them the right to a certain quality of healthcare that they would otherwise have.
Mm-hmm.
And, if people are thinking about chronic disease management or all sorts of health issues, most people would say, well, yeah, of course, you can't take away a person's basic human right to maintain their health. But that's exactly what we do.
Yeah.
Any country that supports needle and syringe programs in the community but not in prison is explicitly breaching that human right. You rightly argue in the same way as treating diabetes or other health issues, taking a preventive approach is much cheaper than dealing with the problem once it occurs. So we have a situation in prisons where it is a location that has the highest clustered prevalence of hepatitis C in the community by a long way. You have people who continue to inject drugs in prison, and if they are not infected with hepatitis C when they go into prison and continue to inject in an environment where you've got such high prevalence and no evidence-based means of protecting yourself from acquiring the disease, they're at very high risk.
I mean, you mentioned in your paper that there is some hope of the ACT getting a bit brave on this issue.
Yeah.
What's the situation there?
So this has been kicking along for many years in the ACT. Successive chief ministers of the ACT have been supportive of trialling a prison needle and syringe program. Mm-hmm. Indeed, in the previous iteration of the national bloodborne virus strategy, it was explicitly noted in there that a goal under that strategy, the length of that strategy, would be to find an appropriate trial site for a prison needle and syringe program.
Yep.
And all health ministers signed off on that document, including our Commonwealth Health Minister at the time. The ACT has been the only jurisdictional government that's genuinely pursued that idea. They commissioned the Alexander McConaughey Centre as the ACT's first prison, not that long ago, and that prison was always meant to be designed on a human rights framework that was supposed to be compliant with the ACT Human Rights Act. Rightly or wrongly, the government did not decide to implement the prison with a functioning needle and syringe program. Unfortunately, the major barrier in Australia is the Community and Public Sector Union, who for a long time have been opposed to introducing needle and syringes into prisons.
Presumably on safety grounds and security grounds.
Yeah, look, safety for a long time has been their main issue.
Yep.
The notion that needles and syringes would be used as weapons against officers, which is the concern is absolutely legitimate. Everybody is entitled to a safe working environment. However, the evidence just doesn't stack up in relation to that. 25 years worth of evidence around the world has never shown a single report of a needle and syringe that has been distributed through a needle and syringe program ever being used as a weapon against a correctional officer or another member of staff. To some extent, I think the Community and Public Sector Union probably realised somewhere along the line that argument was wearing a little thin.
Yep.
Since it have introduced other reasons why, and one of the key reasons that they cite now is that we should be supporting demand reduction programs in prison better.
Yep.
Treatment, opioid substitution therapy. How could we be complicit in allowing someone to continue their dependent drug use? So that's that's another reason that they commonly cite. So the ACT government were really there was an EBA agreement that coincided with all of this movement, and the Prison Officers Union refused to sign the EBA, primarily on the basis of, we won't allow a needle and syringe program. This continued for a number of years.
Yeah.
So the government was in a really between a rock and a hard place. The way they've got that EBA through is through a side document, a deed of agreement that they have with between the CPSU and the ACT government, and that has allowed the EBA to be signed off on.
Right.
Something that we wanted to draw attention to in this article in the Medical Journal of Australia is referring people explicitly to some of the language in that deed of agreement, and specifically around the requirement for the community and public sector union to engage in a genuine dialogue with the government around a prison needle and syringe program. And our argument is that any genuine attempt to have a dialogue around this must be evidence-based, must
Yes.
look at the evidence.
Yeah.
And as someone who's, across the evidence globally, it would strike me as very difficult for a reasonable person to, on the weight of all of the evidence, after weighing it all up, to say that it would not be a good thing to introduce a prison needle and syringe program, at least as a trial
Yeah.
at the AMC in Canberra. And that has the potential, I think, to influence policy across the country. So I don't think up till now, I don't think there's been a genuine engagement with the issue by the CPSU, but this is an opportunity. It's a conversation that needs to be had with the community, and there are unfortunately very few opportunities these days to engage the population effectively in a health issue that has so much nuance to it.
Well, hopefully this will help get the issue out there a little more.
Hopefully.
Thank you for your time.
No problem at all. Thanks.